Welcome to another deep dive, everybody. Today we are going to be going through a really interesting chapter that one of you sent in, and it's all about endocrinology.
Yeah, hormones.
Hormones. So many of you might not know what endocrinology is, but you definitely know what hormones are and they impact just about everything in our bodies.
Yeah, they really do.
So get ready for a deep dive into all things hormones. And you might be surprised to learn how seemingly unrelated symptoms, fatigue, weight changes, mood swings, can all be linked back to this system.
It's true.
So think of us as your guides. We're going to be highlighting the most important and interesting bits from this chapter that you sent in.
Yeah, we're kind of like giving you a backstage pass to your body's control room.
Exactly. And I think a really good place to start is with the parathyroid glands, because this was something that the chapter called out right away. And I was like, 4 tiny glands
Yeah.
that are the size of a pea
Each one the size of a pea.
that have a huge impact on calcium regulation.
That's right.
Which, calcium, it's not just for strong bones, right?
Oh, definitely not. No, calcium is vital for nerve impulses, muscle contractions, even blood clotting.
Oh, wow.
So very important.
That's so interesting. And so these tiny parathyroid glands are working tirelessly to maintain this delicate balance of calcium in our blood. And the chapter mentioned hyperparathyroidism is a common issue, particularly for women.
Yeah.
Why is that? What should we be watching out for?
Well, you can think of it like this. There are 3 levels of hyperparathyroidism.
Yeah.
Primary hyperparathyroidism is like a rogue gland going into overdrive, just pumping out too much parathyroid hormone, or PTH. And this throws off the calcium balance, leading to high calcium levels in the blood.
Okay.
Now, why women are more prone to this is not completely clear, but some researchers suggest estrogen might be a factor.
Interesting. Okay, so that's one gland going rogue.
Right.
What about the other types?
So imagine a seesaw, right? You got a seesaw, and with secondary hyperparathyroidism, your calcium levels are low, maybe from kidney disease or vitamin D deficiency. And so the parathyroid glands are trying to compensate. Okay.
They're working overtime to bring those levels back up, so it's like someone pushing down hard on one side of the seesaw to try to balance it out.
I see.
And then there's tertiary hyperparathyroidism,
Okay.
where the glands have been working so hard for so long they basically become independent operators.
Oh, wow.
They just keep continuing to overproduce PTH even when calcium levels are normal.
Wow. So what does this look like for someone dealing with this? The chapter mentions some pretty surprising symptoms.
Yeah, it's not just about brittle bones.
Yeah.
Think of things like increased thirst and urination as your body tries to flush out excess calcium.
Oh, wow.
You might experience fatigue, nausea, even constipation.
Oh, gosh.
But here's where it gets really interesting. Hyperparathyroidism can also impact mental health.
Really?
Yeah, so you might have depression, anxiety, even memory problems.
Wow. So something seemingly unrelated, like mood swings,
Right.
could be a sign of a parathyroid issue.
Exactly.
That's crazy.
Yeah.
So what can you do if you suspect something's up?
First and foremost, see your doctor.
Simple blood tests can check your calcium and PTH levels.
Okay.
And if those are high, your doctor might order imaging scans to pinpoint the problematic gland.
Okay.
Treatment varies depending on the severity and the type of hyperparathyroidism you have.
Gotcha.
For mild cases, lifestyle changes like staying hydrated and avoiding calcium supplements can help.
Okay.
But for more severe cases or complications like kidney stones,
Yeah.
surgery to remove the overactive gland is often the most effective solution.
Okay. All right. Well, that's a great overview of the parathyroid gland. So let's move on to another big player, the thyroid.
Yes.
So it's like the body's tiny engine. It regulates metabolism, energy, even how we grow and develop.
Cool.
And I thought it was so cool the chapter had this table contrasting hyperthyroidism, which is too much thyroid hormone, and hypothyroidism, too little thyroid hormone. And it's so fascinating how opposite the symptoms are.
Yeah, it really is.
Like, it's crazy how one tiny gland can have such a big impact.
It's like the thyroid's a dial controlling your body's pace.
Oh, that's a great analogy.
So with hyperthyroidism, everything's sped up. Rapid heartbeat, weight loss, you're feeling hot all the time. Hypothyroidism, it's like everything slows down. Fatigue, weight gain, always feeling cold.
Oh my gosh. So what causes these dramatic shifts?
Well, sometimes it's an autoimmune issue. So in Graves' disease, your immune system mistakenly attacks the thyroid, making it overproduce hormones, which leads to hyperthyroidism.
Okay.
One of the hallmark signs of Graves is exophthalmos bulging eyes.
Oh, yeah, the chapter had a picture.
It can be pretty startling.
It was definitely startling.
Yeah.
What about hypothyroidism?
So Hashimoto's disease is a common culprit there.
Okay.
It's another autoimmune disorder where the immune system attacks and destroys the thyroid,
Oh, wow.
leading to underproduction of hormones.
So let's say you suspect something's off with your thyroid. What's the first step?
Again, blood tests are key. They can measure your thyroid hormone levels.
Right.
If it's hyperthyroidism, treatments might include beta blockers to manage the rapid heartbeat or antithyroid drugs to reduce hormone production.
But for hypothyroidism, the common treatment is levothyroxine, a synthetic thyroid hormone that replaces what your body lacks.
Okay, that makes sense.
Yeah.
So we've talked about the parathyroid. We've talked about the thyroid. Now onto a gland that you probably don't hear in everyday conversation. The pituitary gland.
Right.
What is this and why should we care about this one?
The pituitary gland is like the CEO of the endocrine system. It sits right in the brain.
Wow.
And it controls so many other glands, and it controls so much, including growth.
Okay.
One interesting condition it can cause is GH excess, which can lead to gigantism or acromegaly.
Ah, gigantism. Isn't that where people grow to be incredibly tall?
Exactly.
Like really tall.
Yeah, it happens when the pituitary pumps out too much growth hormone or GH during childhood
Okay.
before the growth plates in the bones have closed, so it's like the body's growth switch is stuck in the on position.
I see.
In adults where those growth plates have closed excess, GH leads to acromegaly. So instead of growing taller, their bones thicken, particularly in the hands, feet, and face. Okay, so what causes GH excess and how is it treated?
Often it's a tumor on the pituitary gland.
Right.
Diagnosis involves blood tests to measure GH levels and imaging scans like an MRI to visualize the gland.
Okay.
Treatment usually involves a combination of surgery to remove the tumor, medications to suppress GH production, and sometimes radiation therapy.
Gotcha. All right. Well, the chapter also touched upon dwarfism and diabetes insipidus.
Yes.
Can you give us a quick overview of those?
Yeah, so dwarfism is a group of conditions characterized by short stature.
Okay.
One common type, achondroplasia, is caused by a genetic mutation affecting cartilage and bone growth.
Okay.
Now, there's no cure, but treatments focus on managing complications and improving quality of life.
Okay.
Now, diabetes insipidus, or DI, is completely separate from the more common diabetes mellitus.
Okay.
It involves an imbalance of fluids due to problems with vasopressin,
Thank you.
which is a hormone that helps the kidneys conserve water, and this leads to excessive urination and intense thirst.
Oh, gosh. That sounds not fun. Okay. Well, speaking of diabetes, that is a condition we hear about all the time these days.
Yes, it's very prevalent.
Extremely prevalent. And the chapter focused on two main types, type 1 and type 2.
Right.
So can you give us a quick comparison focusing on what makes them different in terms of causes and how they're managed?
Sure. So type 1 diabetes is an autoimmune disease where the body attacks the insulin-producing cells in the pancreas.
Oh, wow.
And insulin acts like a key, unlocking cells to let glucose in for energy.
Okay.
So without insulin, glucose builds up in the blood,
Gotcha.
leading to all sorts of problems.
Okay. What about type 2?
Type 2 is like having rusty locks.
Okay.
The body becomes resistant to insulin, meaning the key doesn't work as well.
I see.
So the pancreas tries to compensate by producing more insulin, but eventually it can't keep up and blood sugar levels rise.
Gotcha.
Type 2 is often linked to lifestyle factors like obesity, inactivity, and poor diet.
So managing your diet is super important for both types, right?
Yeah,
What does the chapter say about that?
it's absolutely crucial. The goal is to keep those blood sugar levels stable.
All right.
So balanced meals, portion control, choosing nutrient-rich foods.
Right.
Think lots of fruits, vegetables, whole grains, and lean protein.
Mm-hmm.
Limit sugary drinks, processed foods, and unhealthy fats.
What about exercise? Does that play a role too?
Absolutely. Regular physical activity helps improve insulin sensitivity, making those locks work better.
Okay.
It also helps lower blood sugar levels and boosts overall health.
All right. Well, before we wrap up this section, what are your key takeaways on hyperlipidemia and adrenal gland disorders?
So hyperlipidemia is basically having high levels of fats like cholesterol in the blood.
Okay.
It's a major risk factor for heart disease.
Gotcha.
The chapter explained different types of cholesterol.
Mm.
There's LDL, the bad kind that clogs arteries, and then there's HDL, the good kind that helps clear it out.
Yeah.
Now, the adrenal glands, these sit atop your kidneys, and they're all about stress response, blood pressure, and metabolism. The chapter highlighted two key disorders: Cushing syndrome, caused by prolonged exposure to high levels of the stress hormone cortisol,
Okay.
and then there's Addison's disease, which is kind of the opposite, resulting from underproduction of cortisol.
Okay. All right, so we've covered a lot of ground today.
We have.
From those tiny but mighty parathyroid glands to the pituitary gland, orchestrating this intricate symphony of hormones.
Or symphony.
It's just amazing how these hormones are often working silently in the background, but they can have such profound effects on our growth, metabolism, mood, and overall well-being.
Yeah, you don't even realize how much they're doing.
I know, it's incredible. And if there's one thing that I've learned from this deep dive, it's that understanding the endocrine system is crucial for maintaining good health.
Absolutely.
So stay tuned, because in the next part of our deep dive, we're going to be exploring even more fascinating aspects of the endocrine system.
Yes, we are.
You won't want to miss it.
Welcome back to our exploration of the endocrine system. Last time, we covered a lot of ground from those tiny but mighty parathyroid glands to the pituitary gland, the master conductor of the endocrine orchestra.
I know, it was really fascinating.
Yeah.
And I'm still reeling from just like how much impact these hormones have on our bodies and our minds. It's crazy.
It really is.
And I remember the chapter mentioned some other thyroid conditions besides hyper and hypothyroidism.
Right.
What was it? Thyroiditis?
Thyroiditis.
What exactly is that?
So thyroiditis simply means inflammation of the thyroid gland.
Okay.
And it's a bit of a chameleon in that it has several different types,
Okay.
each having its own unique causes and characteristics.
So can you give us a few examples? The chapter mentioned something called suppurative thyroiditis.
Right. So suppurative thyroiditis is like the red alert version of thyroiditis because it's actually caused by a bacterial infection.
Oh, wow.
So you can imagine it's pretty serious.
Yeah.
Symptoms include fever, pain in the thyroid area, and difficulty swallowing. But luckily, it's pretty rare.
Okay.
Usually treated effectively with antibiotics.
Okay, good. So what about other types that aren't related to a bacterial infection?
Well, there's subacute thyroiditis,
Okay.
sometimes called de Quervain's thyroiditis.
Okay.
This one is often triggered by a viral infection
Okay.
and causes pain in the thyroid area that can even radiate up to your jaw or ears.
That sounds pretty uncomfortable.
It can be, yeah.
So how do you treat that kind of thyroiditis?
So the focus is on managing the pain and inflammation.
Okay.
Over-the-counter pain relievers like ibuprofen can help. And sometimes doctors prescribe corticosteroids for stronger anti-inflammatory effect.
Okay.
The good news is that subacute thyroiditis usually resolves on its own over time.
Oh, good.
Yeah.
The chapter also mentioned drug-induced thyroiditis.
Yes.
As straightforward as it sounds?
Pretty much. Certain medications can mess with the thyroid,
Oh, really?
and a common culprit is amiodarone,
Okay.
which is a drug used to treat heart rhythm problems.
Okay.
Amiodarone is high in iodine,
Gotcha.
and too much iodine can interfere with thyroid hormone production,
Interesting.
which can ironically lead to either hyperthyroidism or hypothyroidism.
Oh, wow. So it's like a double-edged sword.
It can be, yeah.
Okay, well, back to Hashimoto's thyroiditis, which we touched upon earlier.
Right,
It's the most common cause of hypothyroidism in the U.S.
right, exactly. And it primarily affects women,
Right.
especially during middle age.
Okay.
It's an autoimmune disorder, meaning your immune system mistakenly attacks your own thyroid gland.
Right.
Over time, this attack leads to inflammation and damage,
Okay.
eventually preventing the thyroid from producing enough hormones.
So if the thyroid can't produce enough hormones, that leads to hypothyroidism with all those classic symptoms like the fatigue and weight gain.
Yeah.
How is Hashimoto's treated?
The treatment is actually the same as for other causes of hypothyroidism,
Okay.
which is levothyroxine.
Yeah.
It's a synthetic thyroid hormone, and it steps in to replace what the body's missing. And regular blood tests help doctors monitor hormone levels
Okay.
and adjust the dosage as needed.
Makes sense. I'm curious about goiters, which the chapter also discussed. What exactly is a goiter?
So a goiter is simply an enlarged thyroid gland.
Okay.
Picture a balloon inflating in your neck.
Okay.
It can have various causes ranging from iodine deficiency to Hashimoto's thyroiditis, Graves' disease, or even certain medications.
Wow. Okay.
Sometimes goiters are caused by nodules,
Okay.
which are lumps within the thyroid gland.
So are goiters always like a serious problem?
Not necessarily. Many goiters are small and don't cause any symptoms.
Oh.
You might not even know you have one.
Interesting.
But larger goiters can press on structures in your neck,
Yeah.
making it hard to swallow or breathe.
Oh, gosh. Okay, so if a doctor suspects a goiter, what happens?
So they'll likely order blood tests to check thyroid hormone levels and imaging studies like ultrasound to see what's going on with the gland.
Okay.
Yeah.
And the treatment would depend on the underlying cause of the goiter, right?
Precisely so. For instance, iodine supplements are usually recommended if the goiter stems from iodine deficiency.
Okay.
For goiters linked to hypothyroidism or hyperthyroidism, treating the underlying thyroid condition is key.
Okay.
And sometimes surgery to remove part or all of the thyroid might be necessary,
Right.
especially if the goiter is causing those breathing or swallowing issues we talked about.
Okay, that makes sense. The chapter also went into some detail about thyroid nodules.
Yeah.
Are those something to worry about?
The good news is that most thyroid nodules are benign,
Oh,
meaning they're not cancerous.
good.
But here's the thing, they're incredibly common.
Oh, really?
Over half of us will develop at least one nodule in our lifetime.
Wow, I had no idea.
Yeah.
Okay, so how do doctors figure out if a nodule is harmless or something more serious?
It starts with a physical exam.
Okay.
The doctor will feel your neck, checking the size and consistency of the nodule.
Okay.
They'll also ask about your symptoms and medical history. Blood tests to measure thyroid hormone levels are usually done as well.
Okay. And if they suspect that the nodule might be cancerous?
Then they'll likely recommend a fine needle aspiration biopsy, or FNA.
Okay.
Don't let the name scare you.
Yeah.
It just means they use a thin needle to extract some cells from the nodule,
Okay.
which are then examined under a microscope.
And if the FNA confirms that it is cancer?
Well, the good news is that thyroid cancer has a very high cure rate.
Oh, that's good.
If it's caught early.
Okay.
Treatment usually involves surgery to remove part or all of the thyroid gland.
Okay.
Sometimes radioactive iodine treatment is used after surgery to destroy any remaining cancer cells.
Wow. It's incredible how advanced medical technology has become.
It really is.
It gives you peace of mind knowing that these conditions can be diagnosed and treated effectively.
Absolutely. Early detection is key. So regular checkups and being aware of any changes in your body are so important.
Yeah, great advice.
Ah.
Okay, well, we've covered so much ground on the thyroid. Let's shift gears back to the pituitary gland, the maestro of the endocrine orchestra.
Yes. This tiny gland nestled at the base of the brain, it produces hormones that regulate a wide range of bodily functions.
Right.
From growth and metabolism to reproduction and stress response. It's a real powerhouse.
It's tiny but mighty.
It is.
And we talked about gigantism earlier, but the chapter also mentioned acromegaly, which is caused by excess growth hormone in adulthood.
Right.
So what's the difference between the two?
So think of it this way. With gigantism, excess growth hormone happens during childhood before the growth plates in the bones have closed.
Okay.
So you get excessive growth in height.
Right.
Acromegaly, on the other hand, develops after those growth plates have fused.
Okay.
So instead of growing taller, people with acromegaly experience a thickening of their bones,
Right.
especially in their hands, feet, and face.
So besides the bone changes, are there other symptoms of acromegaly?
Definitely, acromegaly can also lead to enlarged internal organs, carpal tunnel syndrome, sleep apnea, high blood pressure, and an increased risk of diabetes.
Gosh, that's a lot.
Yeah. So early diagnosis and treatment are essential to prevent these complications.
So how is acromegaly diagnosed and treated?
Blood tests can measure growth hormone and IGF-1 levels, which is a growth factor that's typically elevated in acromegaly.
Sure.
Imaging studies like MRI can help visualize the pituitary gland and look for any tumors that might be causing the problem.
And the treatment?
Often it involves a combination of surgery to remove the tumor, medications to suppress growth hormone production, and sometimes radiation therapy.
Okay.
The goal is to get those hormone levels back to normal,
Right.
control symptoms, and prevent long-term complications.
Makes sense.
Yeah.
Okay, well, we've gone from tiny parathyroid glands to the pituitary gland, orchestrating this intricate symphony of hormones.
It is a symphony.
And we're not done yet.
No, we're not.
Remember those other conditions the chapter mentioned, dwarfism and diabetes insipidus? We'll unpack those next. All right, so welcome back to the show. Before the break, we were talking about the pituitary gland and its role in conditions like gigantism and acromegaly. Now let's switch gears to dwarfism, which is a topic that the chapter explored in some detail.
Yeah, this is a fascinating area of endocrinology because it really highlights the delicate balance of hormones and genetics in regulating growth.
Right.
You know, it's actually an umbrella term for various skeletal dysplasias,
Okay.
which are conditions that affect how bones and cartilage develop.
So the chapter specifically mentioned achondroplasia as a common type of dwarfism.
Yes.
What makes this condition unique?
Well, achondroplasia is interesting because it results in disproportionate short stature,
Okay.
meaning the limbs are shorter compared to the torso.
I see.
So it's like the body's blueprint got a little mixed up.
Okay.
And this is all due to a mutation in a gene called FGFR3,
Okay.
which plays a crucial role in bone growth. So people with achondroplasia usually have an average-sized trunk, but shorter arms and legs.
So beyond the difference in limb proportions, are there any other noticeable features associated with achondroplasia?
Yeah, often individuals with achondroplasia might have a more prominent forehead,
Okay.
a somewhat flattened bridge of the nose, and a slightly smaller jaw.
Okay.
Additionally, they can experience spinal issues like kyphosis,
Right.
which is an outward curvature of the upper back, and lordosis, which is an inward curvature of the lower back.
So with it being a genetic condition, are there treatments available to address the underlying mutation?
Unfortunately, no, there's no cure for achondroplasia at present. However, the focus is on managing any complications that arise and improving quality of life.
Okay.
So this might involve orthopedic interventions to correct spinal problems,
Okay.
physical therapy to enhance mobility and strength, and of course, psychosocial support to help individuals navigate the unique challenges of living with dwarfism.
So it sounds like a very holistic approach
Mm-hmm.
is crucial to ensure the well-being of those with achondroplasia.
Yeah, absolutely.
Now let's switch gears to another condition that often gets confused with diabetes mellitus. Diabetes insipidus.
Yes, it's so important to differentiate between the two.
Right.
Diabetes insipidus, often shortened to DI, is all about fluid imbalance.
Okay.
It's caused by issues with vasopressin,
Okay.
a hormone that helps your kidneys conserve water.
Right.
Without enough vasopressin, or if the kidneys don't respond to it properly, you end up with excessive urination and just this unquenchable thirst.
Oh my gosh.
Yeah.
So the chapter mentioned different types of DI.
Right.
Can you break those down for us?
Absolutely. Think of it like this.
Okay.
Central DI is the most common type.
Okay.
And it's like the signal from the brain is weak.
Okay.
So the pituitary gland, remember our endocrine CEO in this case, it's not producing enough vasopressin.
Okay.
Then there's nephrogenic DI,
Okay.
where the kidneys are like a team that doesn't listen to the coach. They don't respond properly to vasopressin, even if there's enough of it.
Interesting. Okay.
And then you have gestational and dipsogenic DI.
Okay.
Gestational DI, as the name suggests, is unique to pregnancy,
Okay.
while dipsogenic DI is caused by a faulty thirst mechanism in the brain.
So like your thirst switch is stuck on high.
Exactly,
Right.
leading you to drink excessive amounts of water,
Oh my gosh.
which then leads to lots of trips to the bathroom.
Oh wow. Okay. So how do doctors diagnose DI and figure out which type it is?
Well, it's a bit of a detective process.
Yeah.
They'll analyze urine to check its concentration and volume,
Okay.
measure vasopressin levels in the blood, and sometimes use a water deprivation test
Okay.
to see how the body reacts when you're not allowed to drink.
Oh gosh.
Yeah, it sounds tough, but it helps pinpoint the problem.
Yeah. Okay. So knowing the type of DI must be crucial for deciding on the best treatment, right?
Absolutely.
Yeah.
For central DI, synthetic vasopressin, usually in the form of a medication called desmopressin, can be prescribed. For nephrogenic DI, the focus shifts to addressing the underlying cause,
Okay.
which might involve adjusting medications that could be contributing to the issue.
Gotcha.
And for dipsogenic DI, behavioral therapy can help people manage their excessive thirst.
Okay. That makes sense. Well, we've covered an incredible amount of information today.
We have.
From those tiny parathyroid glands to the master conductor, the pituitary gland, and all the fascinating conditions that can arise when this intricate endocrine system is disrupted, it's been quite a journey.
It really has. It's amazing how these hormones, often working silently in the background, can have such profound effects on our growth, metabolism, mood, and overall well-being.
And if there's one thing I've learned from this deep dive, it's that understanding the endocrine system is so crucial for maintaining good health.
It really is. And remember, this is just a starting point.
Yeah.
We encourage you to explore the resources we've provided in the show notes if you're interested in learning more. And as always, if you have any concerns about your health, please reach out to a healthcare professional for personalized advice.
Well, thank you so much for joining us on this fascinating exploration of the endocrine system. Hopefully you've gained a deeper appreciation for this incredible complexity of your own body and the powerful influence of these tiny chemical messengers we call hormones. Until next time, stay curious.